Hello friends, I am Dr Debashish Chanda, the knee joint specialist. So today we are going to discuss about knee arthritis. What is wear and tear of knee joint? First of all, we will understand what is a normal knee. So as you can see in this X-ray, the thigh bone and the leg bone is there and there is a gap in between. Usually this gap should be present. What is there in between this gap, which is not visible? This is the blue lining, as you can see in this other picture. The blue lining is the cartilage. The function of cartilage is to prevent bone-to-bone friction as well as providing lubrication to the joint. So let's come back to the X-ray again. How can we say that the gap is or the cartilage is good in between the joint? Please consider the medial joint space, inner or the outer joint space. They should be comparable or equal to each other. Number 2, the articular lining should be smooth. There should not be any uneven bone. Lastly, if we draw a line in between the joints, it should pass through the center of knee as well as center of thigh and leg bone. Now come to the arthritic joint. You'll see the gap is uneven now. There are a lot of small extra bone formation on the sides which are due to rubbing of bone. Secondly, their bone is uneven. And lastly, if you draw a line, now you will see that the knee is bending outside. So these are the changes which are visible on an arthritic knee, which makes it different from the normal knee. So what are the problems patient complains? Number 1, there will be pain because of friction. Number 2, whenever there is friction, there will be swelling. So excessive amount of fluid accumulation or inflammation will be there. 3, the patient will have difficulty in walking. There will be pain on walking as well as pain in the resting time. Again, there could be instability or giving away while walking. So patient will complain, I am not stable. So these are the symptoms which are very common with arthritic knee.